I'm Diana Farmer. I am a fetal surgeon. I operate on babies in the womb, and I am the chair of the Department of Surgery at UC Davis. I have had the privilege of having federal funding that helped jumpstart my longstanding research in how to improve the lives of children with spina bifida. So this is a disease where the spine doesn't form, so the spinal cord is exposed during gestation, and that ultimately results in paralysis, incontinence, lifelong disability for these children. But with our original federal funding, we were able to discover that if you operate before birth, same operation that we did after birth, if you do it before birth, that changed the lives of these children tremendously. It was a 50% reduction in the need for many of the support that these children need. So since then, we have gone on to explore adding stem cells to improve the paralysis part of this disease. And that work has the potential to change lives, have no child be in a wheelchair, and that's our goal. The original NIH funding funded a trial called the MOMS trial. It took us 10 years to accomplish, but what we showed was that half of the children no longer needed what's called a ventriculoperitoneal shunt to drain fluid on the brain. And if you have fluid on your brain, it doesn't develop properly. So by reducing the need for that in half, it was life-changing for these children. I was just listening to our department's grand rounds this morning, where the review of the history of lung cancer treatment and lung cancer surgery was presented. And I couldn't help but think of how much the care and the cure of patients with lung cancer has changed due directly to funding from the National Institutes of Health. And if this funding were to go away, or frankly, even be reduced, it would drastically change. We would stop having cures for many of these diseases. In fact, I think we need more funding for the National Institutes of Health, not less.